Hi everybody, I'm Dr. BIzzy Riley and I want to talk to you about stomach acid. A lot of us know people who are on acid blocking medications because of heartburn, but did you know that most of the people who have heartburn actually are not making enough stomach acid? And I'm going to explain to you why. So here's your esophagus. Your esophagus begins kind of in the back of your throat. Your esophagus leads into your stomach. That's your stomach, and then your stomach leads into your small intestine. Between your esophagus and your stomach is something called the lower esophageal sphincter. Yes, I said sphincter. So basically, the job of the sphincter is to protect the esophagus from the acid that's in your stomach. So your stomach has a nice protective lining because it's always making acid in there. Your esophagus does not have that protective lining. So when you feel a sensation of heartburn, it's because that acid is getting up into your esophagus. The job of this sphincter is to close when it gets acidic enough in your stomach. It's always a little bit acidic in there. But when we anticipate eating, so we smell food, we think about food, we start to chew, we begin to swallow, that triggers the release of more acid in your stomach. What happens is that if it never gets acidic enough, if you don't make enough stomach acid, and I'm going to explain why that could be, then you will never close this sphincter and that acid will continually reflux up into your esophagus. So the thing is that ideal digestion happens in conditions where we're, for example, sitting in the Tuscany countryside having a 3-hour meal with 5 courses and we're relaxed. Very few of us are actually in a relaxed state when we're eating anymore. A lot of us are eating on the go. We're stressed out about our lifestyle. We're not enjoying the food that we're eating. So if we can't get into that relaxed state, we can never make enough stomach acid. So we're all walking around stressed out, not making enough stomach acid, and lo and behold, then you get reflux. So when you're put on an acid blocking medication, what happens is it does suppress acid production, so you're never quite making enough to reflux. But the problem is then you're not quite making enough acid to actually break down, digest, and absorb your nutrients, and that can lead to a host of other problems. So I really want you to think about this scenario, and if you think this might apply to you, then go ask your physician about other alternatives for healing your digestive upset. I'm Dr. BIzzy Riley, and if you want to read more about this, by the way, it's all on my blog. It's www.drbizzy.com. Check on the blog link and you can read all about it. I'm Dr. BIzzy Riley, live like you give a damn.